Welcome to Mind Matters. Today we're exploring how mental health varies across genders, a fascinating area with implications for well-being and treatment. Gender differences in mental health aren't just biological. They're influenced by social, cultural, and environmental factors as well. Did you know that mental health disorders are more prevalent in women, while substance use disorders are more common in men? Research shows that women are more likely to experience anxiety and depression, while men face higher risks for substance abuse. Understanding why these differences exist can help us develop better mental health support tailored to everyone's needs. Let's start with depression, a disorder that affects both men and women but presents differently in each. Statistics reveal that women are twice as likely to experience depression compared to men. However, men often show symptoms of irritability, anger, or risk-taking instead of sadness, which can lead to underdiagnosis. Society's expectations often discourage men from expressing vulnerability, contributing to a hidden epidemic of male depression. Hormonal differences, especially related to estrogen and progesterone, play a role in how women experience depression. Life events like pregnancy, childbirth, and menopause can also increase vulnerability to mood disorders in women. Another significant area is anxiety, where gender plays a major role in who experiences it and how. Studies show that women are nearly twice as likely to be diagnosed with an anxiety disorder than men. This may be due to hormonal influences and the tendency for women to internalize stress. Men, on the other hand, often channel anxiety into physical outlets, sometimes leading to anger or even aggression. Societal expectations can cause men to suppress their anxiety, leading to underreported cases. Unfortunately, untreated anxiety in men can lead to substance use or even physical health problems. Let's talk about substance use disorders, an area where men are disproportionately affected. Men are more likely to misuse alcohol and drugs as a coping mechanism for stress and anxiety. This can be linked to societal expectations that discourage emotional vulnerability in men. Women, however, experience faster progression of addiction and are more susceptible to the negative effects of substance abuse. Recent studies show that women's bodies metabolize substances differently, which can intensify dependency. Trauma, especially related to abuse, is a significant factor in women's addiction, which often goes unnoticed. On the topic of eating disorders, we see a stark contrast between genders. While eating disorders can affect anyone, they are significantly more common among women, especially young women. Social pressures on women's body image have been linked to higher rates of disorders like anorexia and bulimia. However, eating disorders in men are often overlooked due to the misconception that they are a women's issue. Men with eating disorders may focus on muscle gain rather than weight loss, leading to conditions like muscle dysmorphia. Despite this, eating disorders in men are underdiagnosed, highlighting the need for greater awareness. When it comes to post-traumatic stress disorder, PTSD, both men and women can be deeply affected, but often show different symptoms. Men with PTSD are more likely to exhibit aggressive or avoidant behavior. Women, however, may experience more internalized symptoms such as anxiety, depression, and social withdrawal. Society often expects men to tough it out, leading to lower rates of men seeking help for PTSD. Women are more frequently diagnosed with PTSD due to higher rates of trauma from events like domestic violence. Unfortunately, societal stigma can discourage both men and women from seeking help for PTSD. Now let's explore how hormones influence mental health across genders. Hormones like testosterone, estrogen, and cortisol play crucial roles in regulating mood. Fluctuations in estrogen can increase women's vulnerability to mood swings, anxiety, and depression. Men, on the other hand, experience mood changes linked to fluctuations in testosterone, often related to stress. Puberty, pregnancy, and menopause can have significant mental health effects due to hormonal changes in women. In men, hormonal changes linked to aging can impact mood, energy, and mental resilience. These biological differences highlight the need for gender-sensitive mental health approaches. Beyond biology, social and cultural factors also play a role in gendered mental health differences. Men and women often face different societal pressures that shape their mental health experiences. For instance, Women frequently encounter body image expectations, contributing to higher anxiety rates. Men often face pressure to be stoic, leading to hidden struggles with depression or anxiety. Society's portrayal of ideal masculinity and femininity can impact self-esteem and mental health. Understanding these societal expectations can help us break down stigmas around mental health. Let's discuss the impact of social support on mental health across genders. Studies show that women are more likely to seek support from friends and family. Men, however, tend to rely on fewer social supports, which can make mental health struggles isolating. Building support systems can improve mental health outcomes for both men and women. It's important to encourage everyone, regardless of gender, to reach out for support. Another significant issue is access to mental health care, which varies across genders. Research shows that men are less likely to seek mental health treatment compared to women. This reluctance is often due to stigma or beliefs that men should handle problems alone. Women are more likely to seek help but may face barriers like limited mental health care resources. Accessible, gender-sensitive treatment can help close the gap in mental health care. Programs that focus on breaking down gender stereotypes are essential for better mental health outcomes. Therapists are now trained to recognize gender-specific needs in their clients. These approaches create a more inclusive and supportive environment for everyone. Schools and workplaces are also focusing on mental health support that considers gender differences. Providing safe spaces for open conversations can foster understanding and acceptance. Let's talk about self-care and how it can be adapted for men and women's unique needs. For women, practices like mindfulness, journaling, and social connection can improve well-being. For men, exercise, practical problem-solving, and structured routines often work well for managing stress. Encouraging personalized self-care routines can help individuals manage mental health effectively. Let's remember that mental health is deeply personal. There's no one-size-fits-all approach. Thank you for watching Mind Matters. We hope this video provided valuable insights into mental health and gender. Like, subscribe, and share this video to help spread awareness and understanding for everyone's mental health journey.